welcome to It Starts With Mom Live. This is a conversation today on healthy hearts for healthy starts. I'm Lisa Schwartz. I'm an actress, author, and a longtime content creator on YouTube. But most importantly, I am a proud mommy to my 1.5-year-old girl, Miss Annie Jones. After my own health heart pregnancy experience with postpartum cardiomyopathy, or as we know it, PPCM, I know how important it is to raise awareness around maternal heart health. So I'm truly so glad and honored to be here with you today, healthy and ready to dive into a topic that all new and expecting moms should know about. Heart health is important for all of us, but particularly if you're pregnant or thinking about getting pregnant. I just actually learned this, but heart conditions and strokes cause more than 1 in 3 pregnancy-related deaths. So it is critical that we educate women about the risks for heart disease and what to do about them, especially because over 80% of pregnancy-related deaths are preventable. So knowing the risk, warning signs, and symptoms can save a life. I am truly honored and humbled to introduce you to our experts that we are going to speak with today. First of all, we have Dr. Amanda P. Williams, MD, OB-GYN, is Interim Chief Medical Officer at March of Dimes. She is a board-certified obstetrician gynecologist and strategic physician leader focused on eliminating maternal health disparities. She leads the March of Dimes mission team to advance efforts in research, advocacy, education, and community programs that will prioritize the well-being of all moms and babies. Next, we have Juliana Crawford, who is the Executive Vice President of Emerging Strategies at American Heart Association. She leads cross-cutting initiatives for the organization that brings science to life to create health solutions and enact powerful partnerships that accelerate the American Heart Association's vision to bring health and hope to everyone, everywhere. The early birth and months-long NICU stay for her twin daughters motivates her commitment to supporting healthier pregnancy journeys. And last but certainly not least, we have Dr. Kjersti Aagaard, MD, Ph.D, MSCI, is the Medical Director of HCA Healthcare Gulf Coast Division, Texas Maternal Fetal Medicine, and HCA Healthcare Research Institute. Dr. Aagaard carries an academic appointment with Boston Children's Hospital and Harvard Medical School. Dr. Aagaard joined HCA after spending 2 decades as the Henry and Emma Mayer Endowed Chair and Professor in Obstetrics and Gynecology and Vice Chair of Research at Baylor College of Medicine and Texas Children's Hospital. With continuous NIH funding, the NIH Director's New Innovator Award, and additional funding from USAID, March of Dimes, Gates Foundation, and National Science Foundation, she and her team members have shared their landmark discoveries and developed technologies that have enriched translational and discovery science aimed at reducing perinatal, maternal, and infant morbidity and mortality. Her impact has been nationally recognized with receipt of numerous awards. So to say we are lucky to have these knowledgeable and accomplished women with us today would be an absolute understatement. So let's go ahead and dive right in. First of all, cardiovascular disease is one of the leading causes, as I mentioned, of maternal death in the US. So for our viewers like me who may not have known, what does cardiovascular mean exactly during pregnancy specifically?
So that's a great question. And cardiovascular disease, sometimes we think about it just around the heart, but cardiovascular disease accompanies everything about the heart and all of its blood vessels, which literally cover you head all the way down to toe. So, cardiovascular disease are the things we often think about, such as congenital heart anomalies, having a stiff valve, or having to have your heart plumbing rerouted after birth, but also having heart attacks, which is a narrowing of the arteries that can cause significant problems. As you mentioned, it can be cardiomyopathy when we have that dilated left ventricle and that heart pump isn't working as well. It can also be limited more to vascular disease, such as when you have a clot or an infarct in the brain, which is a stroke, or you can have clots and microvascular disease in the placenta, which can lead to preeclampsia. So, this full spectrum of cardiovascular disease of the heart and all the vessels that our blood travels out of the heart and back to the heart is what accompanies cardiovascular disease, and it manifests in many different ways during pregnancy, more of which we're going to have an opportunity to talk about today.
Thank you. Well, according to the American Heart Association, pregnancy-related deaths in the US have risen over 140% over the last 30 years. And heart conditions and strokes are the leading cause. So is there anything that we can do to reverse this seemingly alarming trend?
Yeah, great question. We at the American Heart Association believe there are things that we can do. We founded a movement called Go Red for Women nearly 2 decades ago because most women do not realize that cardiovascular disease, heart disease, is the #1 killer. And it's also the #1 killer of new moms. And so several years ago, we really increased our emphasis on maternal health with the American Heart Association. And we think there are ways that we can do better. We need to increase awareness and understanding of these issues among young women that are thinking about becoming pregnant, planning for their pregnancy, are pregnant, are recovering from pregnancy. We know that there are policy levers, there are things that we can do at the federal and state level to ensure that moms have access to care through all of these stages of their life. And we need to continue to advance the science in this space. And so our clinicians are making the connection here between heart disease and the unique things moms experience in pregnancy, and there's a lot we can do there. And so really the Heart Association, partnering with organizations like these around the table, believe that we can do better in this space, and we can drive for healthier outcomes for new moms.
I think I'm going to continue to say this throughout our conversation today, but I'm just so grateful for the work that you are doing, because truly, as a new mom, I had no idea there's so many other things to think about. So I had no idea that heart health was so important. So thank you all for the work you're doing. The CDC has also reported that 80% of pregnancy-related deaths are preventable. So what can expecting moms do to help prevent heart-related complications throughout, before, after their pregnancy?
So one of the places to start is with your history. And so knowing your history, your family's history, and to share it with your physician or midwife as you're going into prenatal care is incredibly important. Someone might blow off, oh yeah, they said I had a murmur as a kid, or oh yeah, I had that surgery, but I was 10. These things actually matter when you are pregnant. Another piece of advice I always give is never interact with the medical system alone. Oftentimes it's so easy to get overwhelmed with all the information that's coming at you. It's easy to get mom brain or postpartum brain and not remember everything. So whether that's your partner, your doula, your sister, whoever's coming with you, have somebody take notes, remind you when that interaction is going on. And then buy a blood pressure cuff. We're going to talk about preeclampsia and blood pressure more, but one of the most common ways where our vascular system is impacted in pregnancy is around blood pressure issues. And oftentimes those happen without any symptoms. There can be symptoms, but why register for another frilly dress when you can have a blood pressure?
Oh my God, I love that. And I wish I had this information, truly. I love this idea of you're empowering people to be an advocate for themselves, but also having an advocate there for them to be a second set of ears. So that's fantastic advice. Are there any certain warning signs and risk factors of cardiovascular disease that expecting moms should be aware of?
For sure. So the tricky part is that some of these same symptoms could be a nothing. They could just be a regular pregnancy symptom. Shortness, feeling short of breath,
yes,
having a headache, having swelling in your legs. These things can happen anytime. Chest pain sometimes could be reflux. But if these things are persistent, if these things are severe, or if you're just not feeling right, please bring them up to your physicians. I am one of those maternal mortality review committee members for the state of California. And in so many of our reviews, patients were having symptoms and they weren't really being listened to.
Yeah.
Unfortunately, we live in a country where there is still quite a bit of bias against women, against people of color. Oh, honey, you're fine. Oh, you're just tired. And women get blown off. And so making sure that you and your family members and your community are advocating. And then part of my job is to train doctors to listen harder. I say the more different someone is from you, the harder you need to listen, because you do not have those cognitive reminders that say, this is someone to protect. This could be my cousin. This could be my sister. So if someone's more different from you, you need to listen harder, because some of those common symptoms could be the first presentation of something very serious, like the cardiovascular experience that you had, Lisa.
Oh my God. I mean, I feel like I will have chills, but I also want to clap and cry all at once. Like, everything you're saying is so astute and right on point. I was just told it's just anxiety. It's just anxiety. A lot of tapping on my head of it's just anxiety. And thankfully, I had some friends be advocates for me. So thank you for that. We often hear that knowing your blood pressure, like you mentioned, is important throughout the pregnancy. How do I know what healthy blood pressure is and what the link between blood pressure and heart disease is? I'm still confused about blood pressure numbers. It's confusing.
It is confusing. And so, that's why, to build off of what Dr. Williams was raising, it's so important to have a relationship with a provider and a healthcare network, and with people you trust and listen to you. One of the things that drove me to join HCA Healthcare is because it's a comprehensive network that has a long-standing experience of working in the community with patients right by your home, so you don't have to drive 60 or 200 miles to get care. We are here in your community, and we bring healthcare to women. And part of that, key aspect of healthcare is not only paying attention to your symptoms, having an advocate with you in your appointments, and bringing those to the attention of your provider, but also measuring your vital signs, including your blood pressure. We all wear Fitbits these days, and the number of times I've had women come in and say, my heart rate's up and I need to know about my blood pressure. Well, you can measure your blood pressure at home. So what's a normal blood pressure? Well, in pregnancy, it actually changes a bit. So in the first part of pregnancy, until about 26 to 28 weeks, your systolic, or your upper pumping chamber number, will typically be about 15 millimeters mercury lower. So a normal number is anything under 130 or 140 on the top. A normal number on the bottom is anything less than 80 or 90. So if we put that together, we say we want your top number to be less than 130 or to 140, and your bottom number to be less than 80 to 90. The trick is, early in pregnancy, it's going to naturally be lower, because we're pushing that extra blood volume that we add during pregnancy to pump to our placenta and our baby. We're pushing that out to our fingers and our toes and our brains, and we're dilating a little bit, so our blood pressure naturally drops. What that means sometimes is we're masking women who have chronic hypertension, putting them at risk in their pregnancies. So we're looking for those numbers and we're relating it. Why does blood pressure matter? Well, blood pressure matters because the higher your blood pressure, the more you're putting a strain on the pumping chambers of your heart, particularly your left ventricle. That's related to heart failure, as we talked about earlier. And we're also putting that strain on all of the small blood vessels that are downstream of that left ventricle, because we're trying to push blood harder and harder. And there's a certain amount of reactiveness into those blood vessels. So the relationship between blood pressure and heart disease is twofold. One is it means that our heart has to work harder to get blood out to all of our small vessels, and that puts us at risk of having more small vessel disease. And the second risk to it is just simply the work of the heart going into overdrive, trying to continue us to pump. Why does heart disease frequently present for the first time and more severe in pregnancy? Because we increase our blood volume by 1.5 times, because we have this placenta and this baby we have to perfuse. And so why do women typically present for the first time in pregnancy? Well, we brought up some of it, that we're not always good about listening to women. But the other part of it is that stress of pregnancy, of handling that 50% increase in our blood volume, means that our symptoms may be first unmasked during pregnancy in that big stress test of life.
Well, this makes complete sense now. So I'm glad that we're sharing this information to others that are pregnant now or planning on. So we kind of cover this, but after my pregnancy experience with postpartum cardiomyopathy, I had to wear a heart monitor for 14 days. And I also did daily blood pressure monitoring. Should all expecting moms have heart and blood pressure monitor at home? And how should that be used?
We do believe that monitoring your blood pressure at home is incredibly important. It is something, it's an easy process to learn and to take on. And as Dr. Aagaard talked about, it's really important to at the times of day and the time that you take the blood pressure. And so having blood pressure monitor at home and writing it down and tracking it over time will help your clinician get a better read of that. And so we believe that's really an important practice and a way you can stay healthy through the pregnancy.
Thanks. Also, in addition to cardiovascular disease, preeclampsia is another heart-related complication that we often hear about during pregnancy and that can happen during pregnancy. The March of Dimes states that preeclampsia affects 1 in 25 pregnancies in the US and is the cause of 15% of premature births. What is preeclampsia and why does it have this huge impact?
Well, we got a little bit of a preview around preeclampsia when we were talking earlier about that narrowing and lack of appropriate formation of those arteries within the placenta. So I think of preeclampsia as a disease of the placenta that's unique. It's cured when the placenta is delivered. And so typically sometime between 4 and 6 weeks after that placenta is delivered. We know a couple of things about preeclampsia. It's much more common in women who have underlying chronic hypertension. It's more common in women who have small vessel disease, such as autoimmune disorders or kidney problems. It's more common in women when we're very young and when we're older. It's more common in women who've had preeclampsia previously. In recent years, we've understood that there's a couple of things we can do to reduce the risk of preeclampsia, or certainly the severity of preeclampsia. The first is that we can treat high blood pressure that's chronic hypertension. So, led by Alan Tita, and I was fortunate enough to be a part of the CHAP trial, the chronic hypertension and pregnancy trial. We learned that if we treated women to keep their blood pressure at that goal of less than 130 over 140 for the top number, and less than 80 to 90 on that bottom number, using commonly prescribed medications in pregnancy, such as labetalol or nifedipine, that we have decades of experience on their safety, we reduce the risk of preeclampsia and preterm birth. So we have a very strong evidence base to say if we treat high blood pressure and chronic hypertension of pregnancy to a target goal of less than 130 to 140 over 80 to 90, we will reduce the likelihood that women are delivered preterm because of the chronic hypertension, or that they get preeclampsia and get delivered preterm because of that hypertension. Now, we did two unique things in that study. We looked at both mom and baby outcomes and showed that both benefit, so there's no harm to baby with treating this blood pressure. And the second thing is we enrolled the group of women that were most likely to suffer preeclampsia and long-term problems from their chronic hypertension. And we targeted to 50% Black women enrolled in the study, something that I'm particularly proud of and really applaud Dr. Tita for endorsing. So we know that we can really do what we need to do to get that high blood pressure down and prevent that preeclampsia. The second thing we can do to reduce the chance of preeclampsia and pregnancy is for all of that list of folks who are more likely to develop preeclampsia, using 81 milligram low dose aspirin daily, Starting around 15 weeks and up to 28 weeks initiation, but continuing every single day throughout pregnancy, can drop the likelihood of having preeclampsia among those that are at risk by 25%.
Wow.
Combination of those two things of the folks that are most likely to suffer preeclampsia, women with chronic hypertension, keeping that blood pressure in that target range using safe medications like labetalol and nifedipine, and amongst that myriad of women who are at risk for preeclampsia, that low dose aspirin daily from 15 weeks or so up until delivery is incredibly important in reducing preeclampsia.
You mentioned that some women are like preconditioned to have this and maybe know that going in, but are there certain risk factors and warning signs of preeclampsia that expecting moms who maybe have no clue that this could be something that they could experience should look out for?
So one of the things that we're trying to do at March of Dimes is really get the word out into the community so that patients and family members can actually come to their doctor, come to their midwife and say, hey, am I at risk for preeclampsia? Should I be on low dose aspirin? And some of those risk factors are the ones that have been more readily recognized in the medical community, like being over age 35, having chronic high blood pressure, having twins, having lupus, these sorts of things. And then some are demographic risk factors. And what I mean by that is risk factors that doesn't have anything necessarily to do with sort of who you are medically in the traditional sense, but how our society has unequally provided access to care and treats patients from different backgrounds and brings in those social stressors. So if someone is low income, if someone is exposed to systemic racism, they are also at increased risk because of the way that toxic stress gets inscribed on our bodies. Aren't just ideas. These aren't just things in our head. Our body actually experiences stress that becomes a physiologic change in our body. And I always tell my patients, particularly low income patients or patients of color, that I cannot undo 400 years of discrimination and bias in this country, but I can give you this low dose aspirin as part of the shield that I am putting around you and your baby to help protect you. And that is a way that, because patients can be skeptical. You know, there's a lot of well-earned distrust, particularly amongst communities of color. And when a doctor says, you know, I want you to take this every day for the rest of your pregnancy, that's a big deal for somebody to do. And that's why at March of Dimes in our low dose aspirin initiative, we're really trying to engage social media, engage community, engage families, to be part of supporting this work so that patients know that this is us trying to protect them as opposed to say something's wrong with you and you have to be better. So we're really trying to change the language and support providers and pharmacists and doctors and nurses who are doing this work by providing education, not just on prescribing, but on implementing it in your office and even giving scripts to use about how to have these conversations.
Yeah, that's right. The education is so important because I remember being told I have to take a low dose aspirin during pregnancy, and I did, but I was hesitant because I didn't understand the reasoning behind it. And it felt like, oh, it's just one more thing I'm putting in my body that feels a little bit foreign to me, to someone that maybe doesn't take medication on a daily basis. So you all have kind of covered this, but why is it safe to do? Why is it safe to take low dose aspirin? And is there anything else expecting moms should consider to lower these risks of preeclampsia during pregnancy?
So we have excellent safety data around low dose aspirin. Some of the initial research was actually we call bench research, or sort of in the lab research that March of Dimes was funding. And we've gone all the way from it being sort of an in the lab discovery to becoming recommendation from all of our big national societies like the American College of Obstetrics and Gynecology, U.S. Preventative Services Task Force, Society for Maternal Fetal Medicine, are all in agreement that this is a good idea and a safe thing to do. And now we're on that last mile of getting this behavioral change to get put the practice pieces in place for patients to be taking it. So the same way that somebody takes a prenatal, perhaps in addition to a prenatal vitamin, they might need iron because they're anemic, and low dose aspirin. You know how elderly people sometimes have medication boxes and they have it for each day. That's what I recommend for patients. Just do it for yourself. So every day when you're thinking of your prenatal vitamin to protect you and your baby, same thing with your low dose aspirin. And then Dr. Aagaard had brought up before, monitoring your numbers at home, knowing what your blood pressure is. Many health organizations are actually now giving blood pressure cuffs to patients.
Awesome.
Have Bluetooth enabled or Wi-Fi or cellular enabled Bluetooth cuff, so that they get uploaded and put into your electronic medical record, which is something that we're very supportive of at March of Dimes. So these types of interventions that are not fancy, they are not complicated, they're not super high tech, but they can make just a tremendous difference in the lives of patients.
Absolutely. And it just empowers a mama to be to feel like she has a little more control of something that sometimes feels a little out of control. For our viewers who aren't pregnant, but are thinking about having a baby, is there anything you could do to make sure you're heart healthy before getting pregnant?
Yes, absolutely. And Dr. Williams and Dr. Aagaard have given so many great tips throughout our discussion. But I think number one is have a strong relationship with a healthcare professional. When you are thinking about planning for a family, start talking to your doctor today about that. At the American Heart Association, we talk about life's essential 8, and those are the 7 health risk factors you need to know. They've been talked about today. Important numbers like your blood pressure, your cholesterol, glucose in some cases are really important. And then the health behaviors, the actions you can take, healthy diet, what does that look like? What does your physician think that you should be eating? Your exercise and physical activity recommendations. Sleep is so important. That's one of those 8 factors. And so talk to your healthcare professional, let them individualize a plan for you to ensure that you are as healthy as you can be as you're starting on this journey. And so I think that's just the first thing to do.
I think having these conversations are so important, and you're empowering women to have conversations. And so again, like I mentioned at the beginning, I'm so humbled and honored to be here with you fantastic women doing fantastic things for all the women and our hearts out there. So thank you so much for sharing your expertise and insights to help other moms. And thank you again to our partners for helping us produce this episode and for their support of March of Dimes and families everywhere. We encourage you to learn more by visiting March of Dimes website, www.itstartswithmom.org. There you'll find more information, recommendation, resources, stories from other moms, and the latest up-to-date information you may need. And thank you to March of Dimes and It Starts With Mom for this important program and conversation. Moms are the heart and soul of the world, and every mom and mom-to-be deserves this best, especially when it comes to their health and well-being. This episode of It Starts With Mom educational series was produced with support from our partners at HCA Healthcare, with Clear Blue, Goldbug, Philips Avent, and Sanofi. It Starts With Mom is an excellent resource for moms and moms-to-be and their families to help them along the way through pregnancy and beyond. There's so much we feel like we need to know, and it is impossible to know everything, but we do know that to have healthy babies and families and communities, it starts with mom. So thank you all for joining us in this important conversation. Always remember, it starts with knowledge, it starts with community, it starts with care, and as always, it starts with mom.